Well, it's official. Um, Surgery scheduled. 3.5 weeks. Ah! Oh my goodness. August 7th. I'm excited. I'm really nervous. I feel a lot like when I had my breast reduction in 1996. A lot of the same feelings. Very excited, somewhat nervous, and I know it's going to be life-changing. So at the time when I had my breast reduction, I was so pleased afterwards that I have always said it's the best thing I could have ever done for myself. Well, I've heard so many people say that regarding their lap band surgery, so I'm totally expecting to be saying that come the end of August, or sometime towards the end of this year. My husband is amazing. He's the reason I'm able to have this surgery done. He's so supportive. My stallion, you're awesome. I am an at-home mother of 4. I don't work. I don't bring in any extra income. And so I am aware that me having this surgery is going to strap our family. And my husband is so amazing. He's just willing to do anything he can to support me and make this happen. And I am so fortunate because he's a real gift from God. He's amazing. So my surgery is scheduled for August 7th. I am going to fly to Mexico, to Tijuana, with my husband on the 6th of August, and we will be picked up at the airport in San Diego by staff for my physician, Dr. Curry. They will take us to the hospital where I will have blood work and labs and I don't know, all sorts of stuff done. Then I will be sent off for dinner somewhere. I get to go have a normal meal, which will be nice after having a 2-week diet that's purpose is to shrink my liver. So I'll go have dinner with my husband, then come back to the hospital Angeles for a meeting with my physician, Dr. Curry, and other patients that will be going through the procedure on the following day as well. My husband and I will stay in the hospital overnight that night on the 6th. He gets to stay in the room with me, and on the morning of the 7th, have my surgery, stay overnight again in the hospital. Following morning on the 8th, I'll go to X-ray and have a barium swallow, make sure everything's okay, and then they send us to a hotel where I stay for 2 more nights resting, making sure everything is okay, and then they will pick me up, take us to the airport in San Diego, and I will fly home on Monday, 5 days later. So all that's left for me is to get airline tickets and arrange childcare. So I am very excited. Next step for me is to start the pre-op diet. On the 23rd is when I'll start that. So that is low carbohydrate, proteins, vegetables. And the reason I have to do a liver shrinking diet is because when the person is obese, the liver gets enlarged and fatty, and that causes it to be weak, unhealthy, and fragile. So during the surgery, they need to be able to move the liver out of the way, and sometimes that can cause, if the liver is not healthy, it can damage the liver, cause bleeding and such. So the diet that I'm on for 2 weeks before the surgery will strengthen my liver, shrink it, and eliminate some of the fat that's in it. And so that's for that. Let's see. Immediately after I scheduled this morning the surgery, called a friend who I wanted to share with her because I was so excited, and she had some concerns about me having the surgery in Mexico, because having surgery in Mexico, I am not required to have a psych evaluation. There are a lot of different evaluations and testings, things that she had to have done here. She's having the gastric bypass, but I know that in Mexico they don't require the same things before surgery that are required here, to requirements that are for the purposes of making you qualified, to find out if you're qualified for the surgery. And so she had a lot of concerns because I'm not going to have a psych evaluation, and you know, I think I've had a couple other people who have shown some concerns over me going to Mexico for medical care because there aren't the regulations. Well, I don't know if there are regulations or not, like there are in the US. I'm not from Mexico. All I know is that I have talked to a lot of people who have had surgery in Mexico and have been thrilled and pleased with their care. It's been excellent, everything that I have heard. The hospitals that I have heard about are beautiful, clean, wonderful hospitals. I have heard that, you know, staff is excellent, and I have talked to people who have had procedures done at the very hospital I'm going to with the very physician that I'm having, and have not heard anything negative, and I have been digging to find the negative. So far I have a lot of positive things that I've heard about going to Mexico for care. The only negative thing I have heard is from friends or family here who I don't know if they're really informed about going to Mexico for medical care. Well, I know I'm not. I'm trying to become informed. I feel like I need to. I wanted to find out if some of you could help me out with any websites that I can go to that you know of that have quality products as far as vitamins and supplements that can be taken after my lap band surgery, because I take a lot of supplements right now, and I'm concerned about the pills, swallowing the pills after the surgery. Is that possible? Can you swallow pills? Because I've seen some people that say they can, and some people that say that they take everything by liquid form or chewable. And so I want to show you what I take every day. I have little baggies made up. See, this is some of what I take. I just grab a baggie in the morning. So there's about 10 alfalfa tablets in here. There is beta carotene. There's vitamin D. There's vitamin C. There's, did I say B? Vitamin B. I take glucosamine also because my joints hurt very bad, especially my knees, and that is from my weight, I am sure. What else is here? I take a lot of calcium and magnesium because I have a history of osteoporosis in my family, and I need to take a lot of calcium. I take Silymarin, which a naturopathic physician told me was for people who have taken a lot of medications and it's been really hard on their body. And the Silymarin is to help strengthen, I'm not sure if, I can't remember, my liver or my kidneys. I think it's both. Jesse, I need you to shut that door, please. I also have a history of hair loss for the women in my family, and I know that some people have mentioned they have lost hair post-op, and so